main takeaways are that with screening, we're getting better and better at finding things, and we're getting better and better at measuring things. And a lot of things can be seen there that really become much more complete in terms of a person's health. Some of the things that we find are already recommended to look for, like osteoporosis or breast density. Other things, it's a little more controversial. Do we need to tell people about the extent of their emphysema? Emphysema is really, or COPD, screening is not even recommended, but we do report that. And we're even reporting the extent of it. Coronary calcium, at least only a certain portion of people it's recommended. But we think that it's important to report all these things. And what we're starting to see happen is that, in essence, there are additional findings. The literature reports it in, anywhere between 10 and 50, 60% of people have some additional findings outside of the lung nodules. With the ability to look carefully into these scans, and with, continued improvements in artificial intelligence and image processing, we're going to make additional findings in 100% of the scans. Everybody's going to have findings. So we have to start figuring out how to prioritize things and also what to tell people, because we're starting to get to the point where it's not just measuring simple things like, whether your bone density is down, whether you have osteoporosis, but we're starting to predict things like, by looking at things like, muscle mass or the quality of the muscle, we can start to predict mortality in people, and that starts to get into a whole other area, whether or not how we should be telling people these things. People may not want to know this. So you're starting to get into a whole new areas of what to tell people. How much information do we look for? Do we need to talk to people up front before we start giving them these additional measures? So this is something that's going to happen I think, the major societies are going to have to start getting involved, because we're really, collecting these large databases, and we're starting to learn how to predict things in better ways than we used to. So all of how we present this data, because, the general referring clinician, you start telling them 10 or 15 things about a person, they don't want all this information. They don't want to have to follow up on everything. They don't have time. Patients may not want it. So this is opening up a whole new world of how we report things and how we decide what to tell people and what we offer the clinicians. So whole new world we're starting to look at.